Thanks for staying with us. Now, the Ashanti Regional Police Commander, DCOP Manuel Kujo, has vowed to thoroughly investigate and apprehend military personnel implicated in the recent fatal shooting incident in Yinehini. The incident, which occurred on Thursday, resulted in the death of one resident and the injury of 4 others during a confrontation involving some military men. During a visit to chiefs, victims and the community, DCOP Kujo emphasized the commitment of the Ghana Police Service to uphold the rule of law and ensure accountability for all security personnel involved in the unlawful act. And Abuachi Adam visited the community and has filed this report.
The fatal clash that left 1 civilian dead and 4 others injured at Yinehini in the Ashanti region has sparked outrage, prompting a strong response from the Regional Police Command. During a visit to the community, the police commander, DCOP Kujo, described the incident as a crime scene, vowing to bring to justice the military personnel allegedly involved in the shooting. The deadly clash, which occurred on Thursday between the military and a group of mourners, one in a camouflage attire, has intensified concerns about the use of force by uniformed officers. Eyewitnesses say tension escalated quickly before shots were fired, fatally striking 1 civilian and wounding 4 others. DCOP Kujo emphasized the action of 1 soldier should not tarnish the image of the entire Ghana Armed Forces and assure the public that the police are working impartially to identify and arrest those responsible.
Bring them to justice. Yebe tusa anamoi. And to say we are and yet be different. Apart from we ensuring that justice is served. Na sa onuya ni pakrono disa asemboni ona ejumaboni. Yebe making sure say with the collaboration of the military we will get him out. We enye bonia we would hang it on the neck of the military. He is an individual who did this criminal activity, and we'll fish him out and definitely assure the good people of Yinehini, any Ebusian say, we would go all out to ensure that justice is served.
But some of the victims who sustained injury have been speaking.
Because you see me by now woman or Panian I usually to can become to a business can mensa. News Mukutan and Cronum Sabere Prime me pass Miss Mittum Dahan Cray. And it did don't be decry hard and seems me pray Cacramono. And I'm dashing away at it. Tiscabia the enemy home.
I have been suffering since the incident occurred. I need help. Government must come and support us.
That's what I do me pa. Until maybe I buy any police information for the other some support to you be a vessel say more fan support to you. Stay as you say being young what they are. You bet me being young what they bet me the 8 media for your Jumas or Kwedi. Juma the ID party affair.
Meanwhile, Chief of the area Nana Ampene Boatin Chum II has expressed worry about the incident.
Ubiam Rom Rasso. Na even say provocation crime by
what happened in the community is very unfortunate. I plead with the police and the MP to ensure that the perpetrators are brought to book.
The
member of parliament for Achumamponia said Osayakoto has assured residents of bringing the perpetrators to book.
Truly, the regional commander arrived here together with his entourage. We went and met the chief of Yinehini. We have discussed a lot of things about the incident. What I want to say is that, please, the incident had happened. You want to use this occasion to plead with all the citizens of Yinehini to be calm. And you promise, myself, the chief and the regional commander, you have promised that you follow up the incident and then try to bring those perpetrators to book.
Now, in the Yinehini community, this is where the fatal clash between the military and a group of mourners occurred. At this spot is where some mourners who were confronted by the military sustained injuries, including Kushivi, who is now the deceased in this conversation. Now, the residents in the community are calling for justice. They want the police to fasten the investigation into the matter. For Joy News, my name is Nana Abuachi Dankwa Yadom, Kumasi.
Away from Kumasi, the Public Utility Workers Union is urging government to proceed cautiously with its plans to introduce private sector participation in the operations of the Electricity Company of Ghana and the Northern Electricity Distribution Company Limited. Tensions are rising nationwide as pool members step up their resistance to the government's decision. Red flags have been raised at all 92 districts offices and 14 regional administrative centers across the country, following confirmation by the Finance Minister, Dr. Kasi Alato, forcing that Cabinet has approved the controversial proposal. Now, at the headquarters of the Volta River Authority and ECG located at Electro Volta House here in Accra, workers have intensified their demonstration, wrapping red cloths around signposts and hanging protest banners at the main entrance. The protests are expected to escalate beginning Monday, April 28, with workers set to wear red armbands and undertake further protest action. Well, let's get on Zoom now and speak to the General Secretary of POOL. Thank you so much for your time, Timothy Yami. Now, given the public dissatisfaction with the quality of service, what alternative reforms is POOL proposing to improve ECG and NEDCO's operation without involving private entities?
Thank you very much, and my greetings to your viewers and listeners. Yes, so as we said earlier on in our last discussion, we said with our engagement with the Ministerial Committee, who stated its stand when it comes to private sector participation in the energy sector. The public dissatisfaction in ECG is not something that cannot be dealt with. So in line with that, we stated our position when we presented our position paper to the Ministerial Committee. And we sought discuss with them the way forward, of which we actually stated that they should set up a stakeholder board with inside expertise who can be able to lead the administration of the entity. Also, they should appoint the managing director. Thankfully, His Excellency the President has appointed the managing director who has shown us his clear vision. So they should give him deliverables that the reward and sanctions regime should be instituted. That's why we are asking. That we are
but
saying
you agree
that
some of the challenges ECG and NEDCO face is not really about leadership, but the individuals on the ground doing the work, sometimes, involved in fraudulent activities, the reason why the state is losing money. And that's why government is proposing a private individual takes over that section, the collection of funds.
My sister, at the down level, I can tell you on authority that no infraction is gone unpunished. At every point in time, any staff, because after all, this is a human institution, every staff who offends or who contravenes the regulation and the law of ECG are actually sanctioned. So the problem is not at the down level. The problem is at the top level. That's why we are just asking the government to put in measures. When you put a managing director who can show commitment, give him KPIs to follow, I'm sure these things will stop. Because down there, it is not like that.
We know that red flags have been raised nationwide. I'm wondering how far is POOL willing to escalate its action if government refuses to revert its decision?
Okay, so the red flags are showing a dissatisfaction with the pronouncement of Honorable Minister of Finance. Because the last discussion with them, they indicated that the report was an internal report, and it wasn't a final report. For us to hear that the report has gone to Cabinet, the Cabinet has given Cabinet approval, we are actually expressing our displeasure and asking government to rethink, let us use these processes that will best be in the benefit of the benefit of Ghanaians. That's why we are raising a red flag.
But some government officials, they argue that private participation could bring efficiency in the sector as well as investment. From POOL's perspective, what specific risks do you foresee for ordinary Ghanaian consumers if privatization proceeds?
My sister, so what are the ministries? Are we saying that the ministries are inefficient? Look, you have recruited staff and you have given them training. These are experts in the industry. Just a matter of the controls and monitoring. So you don't need, you only need to, a human being needs to be controlled and monitored, rewarded when he works, and sanctioned when he does not. So that's all that we are saying. Because look at the other ministries. Are you saying that we privatize them because they are inefficient? And are you sure they are inefficient? There are records to show that private sector in energy sector, even in Africa, it has not been beneficial. It does not help. This is a country that has about 75% penetration of energy power across the nation. Are you going to bring a so-called private sector to manage? That government who has been given the mandate cannot manage? When government appoints someone who is not delivering, you change. And I know, I mean, he certainly can do it. The minister too should have oversight responsibility over all the activities in the sector to sanction and reward the people. And so, because we know that we have the expertise.
Well, looking at the financial pressures on the energy sector, including the debts owed to the IPPs, does POO acknowledge any internal reforms needed within ECG and NEDCO to ensure sustainability without privatization?
So, sister, we have stated time and again, even about the pricing of the bulk power we purchase, compared to any of African countries. And I'm surprised nobody is talking about that. When ECG went to reform, where we moved our cash collection from 700 to 1.2 million, 1.2 billion, still we couldn't pay the IPPs, and nobody is concerned. You collect revenue and you are paying about 60% of the revenue to the IPP and the rest. That's one of the factors that we should be looking at. And we are saying that, look, the clauses there, show that you can be able, there should be a period for what, renegotiation. For instance, we are buying power in dollars. So we go and sell the power and collect the cedis, come and change it into dollars and pay. Price is fixed. Then we are not renegotiating. Meanwhile, there are clauses of renegotiation. And we are also looking at our neighboring countries, the pricing of energy in our neighboring countries. Have we taken our time to look at it? And I'm even more worried. I'm very seriously worried about that nobody is looking at that. That we go and sell power and go and collect the money and go and give it to the people in dollars. And no negotiation is coming, nothing. You have to look at it. I'm praying that people like you should also let us actually go and see what it takes to actually buy power in such a huge price. And then when it's time for us to review the pricing, nobody speaks about it.
Okay.
We can renegotiate. You see, the circumstances that brought about this pricing, we're in a crisis period. So, you know, when you are thirsty, in the water, you don't look at the quality of the water. When you are very, very thirsty, take anything. But at least when you are seen to be satisfied, you have to again sit back and look at what you are actually buying.
Okay. Thank you so much, Mr. Timothy Yami. He is General Secretary for POO. Away from that, the Acting Chief Executive Officer of the Youth Employment Agency, Malik Basintale, has made a firm declaration not to renew the existing contract with Zoomlion Ghana Limited if the current wage of 250 Ghana cedis for sanitation workers remains unchanged. In a broadcast, Basintale criticized the current terms of engagement, describing them as exploitative and unjust to the Ghanaian youth. His comment follows the growing public pressure, particularly from investigative journalist Manasseh Zuriawuni, who has long campaigned against the contract renewal, citing poor treatment of workers and breach of contract terms.
Somewhere in 2020 decided to open for a competitive tender to be done before settling on who they wanted to settle with. After that competitive tendering was done, the YEA, under the sterling leadership of Mr. Justin Kodia, decided to settle for Zoomlion Ghana Limited. Fast forward in 2022, the YEA again engaged in a contract with Zoomlion Ghana Limited, and that contract was duly signed by my predecessor, Mr. Kofi Ba Ejepon, who I so respect, so much. My brothers and sisters, YEA Zoomlion as we stand now. So long as we are concerned, I admit that there's no existing contract. And that contract was not renewed or was not signed in the last 2 months till election, which meant that for the month of October, November, there was no existing contract between the YEA and Zoomlion Ghana Limited. I have come as the new acting Chief Executive Officer of the Youth Employment Agency. These issues have been brought up, and I have stated emphatically that I am a man who has consistently been up for integrity. I'm a man who has consistently been up for fairness, and I'm a man who has consistently been up for justice. And I will not, on any day, decide to take decisions without binding them to fairness, justice, and accountability. My brothers and sisters, I'm in full support of Ghanaian businesses thriving. However, I would ensure that fairness and justice take their course. My decisions, I know, are subject to the approval of my board, but your opinions and concerns on the decisions I make matter the most, as I have consistently said that I'm a product of the streets and I would go the direction of the streets. My brothers and sisters, I serve a listening president, and so no matter what I do, I must be a listening CEO. I've engaged further, I've thoroughly thought about this through, and I wish today to appear before you, my brothers and sisters, to take your concerns and opinions on this matter. I'm at a 3 point, and the 3 point I am at is 1. Whether, as I would want to rightly put it, even before we get to the 3 points, let me state emphatically that I, as Malik Basintale, has not renewed any contract, and I have not also appended my signature to any contract with Zoomlion Ghana Limited. I wish to state emphatically that your opinions on this matter, like I said before, will matter on the way forward. We are at a point of taking a decision. 1, as to whether to review and amend the previous contract between Zoomlion Ghana Limited, who manages our sanitation model, or 2, to entirely terminate the contract pending the board approval, or 3 is to increase the basic salary. As I have stated earlier, that I shall not on any occasion negotiate any contract that will fall below the minimum wage. Brothers and sisters, we are at a crossroads, and I wish to take all your concerns and comments on this matter. They shall guide our way forward.
Thanks for staying with us. Well, the Vice Chairperson on Parliament Selects Committee on Health, Dr. Sebastian Sandare, has asserted the government's commitment to filling the gaps, including infrastructure upgrades, to elevate the Sunyani Teaching Hospital. Now, during a tour of the tertiary health facility in Sunyani, he stated that the hospital has lacked bold interventions for over 8 years, but assured that the current government will take steps to provide the necessary upgrades to meet the healthcare needs of the people.
The Parliamentary Select Committee on Health's tour of the Sunyani Teaching Hospital (STH) in the Bono region to evaluate its current status, identify challenges, and formulate actionable strategies to enhance the delivery of quality healthcare services is in line with the committee's overarching objectives. Acting CEO of STH, Dr. Cardinal Newton, led the committee to inspect units such as the Accident and Emergency, the Neonatal Intensive Care Unit, and the Waste Treatment Plant. He enumerated some modest successes and challenges, including inadequate infrastructure and a staff welfare policy that caters for the health needs of staff and their immediate family.
Non-availability of essential medical, in fact, MRI is a must. So we are talking about it. The hospital doesn't have mammogram. they had, but it's got 40. Then CM, then endoscopy. Endoscopy, we are working on it to purchase one by the hospital.
Committee member Professor Titus Bayo commended STH for some standout gains and urged them to do more.
It's a relatively new teaching hospital, but they have invested a lot in IT. And I think that is the way to go. It is something all other hospitals must learn. In addition to delivering excellence, they have actually demonstrable results that we can see. I was touched at the pediatric intensive care, the neonatal intensive care unit, to know that a 25-week pregnancy ended and the baby has survived in this hospital and is 3 years old now. I think this is a story that must be told, and we must commend the staff here for delivering excellent care to be able to achieve such a feat.
The committee's vice chairperson, Dr. Sebastian Sandari, said the teaching hospital, inaugurated in November 2023, requires massive support to match its current status. He asserted that the government is committed to filling the gaps for effective healthcare delivery.
Even entering, you can see the level. It's Sunyani Teaching Hospital. Maybe the people probably have some concerns, either when they come, certain things, or there are some gaps that need to be addressed. There are gaps in the equipment because for more than 8 years, there has not been any serious, bold intervention of doing medical equipment replacement or procurement. In his statement, he has boldly stated that he will take steps again to ensure that we have comprehensive medical equipment replacement in all the major hospitals in this country. So the people should have hope. A lot of good things that will promote quality health delivery would be brought by His Excellency John Dramani Mahama.
Precious Semevo, Joy News, Sunyani.
Still on health, Chairman of Parliament's Health Committee, Dr. Mark Kek Nawani, says the committee will push for the Upper West Regional Hospital to be upgraded into a teaching hospital. This follows a visit by members of the Health Committee to the Final Referral Health Center in the region, where they expressed satisfaction with the array of equipment at the facility and the conduct and attitude of its personnel. Former President John Dramani Mahama, during the run-up to 2024 general elections, also pledged to make the hospital a teaching facility with the opening of a School of Medical Sciences at the Simon Diedong Dombo University of Business and Integrated Development Studies to help train more medical doctors for the country. Joy News' Upper West Regional Correspondent Rafiq Salam reports from Wa.
The first point of call of members of the Health Committee of Parliament at the Upper West Regional Hospital was the emergency ward, where they interacted with some management members of the hospital, led by the head of the medical department and physician specialist, Dr. Nabil Depe.
We are well equipped. Of course, we can always improve the situation. One of the things we probably would require a station here is an ultrasound scan machine. We have a number of ultrasound scan machines in the hospital, but at the moment we don't have one purposely for the emergency. And sometimes when patients come, you need an urgent ultrasound scan to make a diagnosis. The big challenge we have is doctors, the medical officers and nurses. Because, no, nurses at the emergency. Yes, nurses at the both those who are specifically trained as emergency nurses and the general nurses. Yes, so that's the challenge because we had to increase the numbers. So increasing the bed capacity here from 8 to 20 plus an additional 10. But we've not had a commensurate increase in number of nurses. So our nurses are stretched. So it's one of our challenges. And then the medical officers as well. So not too long ago, in the night, we had only one doctor on duty. And you can imagine what happens when you have multiple patients coming with emergency. So we've had to stretch ourselves. So currently we have 2 doctors running the night duty. And during the day, there are 3 doctors. But we are so stressed out. There's virtually no rest because every day, they have to be here. So, if we can be helped to increase the numbers, it will help significantly. One thing that I'll use the opportunity to appeal for is the posting of the medical officers to the region and the house officers. So currently we are in touch with the Medical and Dental Council to increase the number of posting we get to the first, because that helps build the numbers.
The issue of inadequate nurses at the medical department also came to the fore.
If we look at the nurses, we are just 20 nurses assigned here. And if we compare, we are currently doing 1 nurse is to 103 patients.
That's quite
and it's affecting us. So based on that, we also detected for the past 2 years, about 4 nurses from the ER developed cardiac conditions. 1 also at a medical ward. So if something can be done about it, so that more nurses will be assigned here to make the work go better.
Members of the health committee also made a whistle-stop visit at the hospital's laboratory, dialysis center, and the intensive care unit.
One thing we need here is the pediatric ventilators. So that is what we don't have. Yes, so but we keep managing pediatric patients because the pediatric department doesn't have its own ICU, so we manage them here. And sometimes we have to adjust the setting of the ventilators, and it's a bit of a struggle sometimes. So if we can get pediatric ventilators, it will help us a lot, because that one is something that we will need. Yes.
The lights go on quite often. So so the time a patient is on vent, lights will go off. It equally affects the oxygen flow, the central oxygen. The plant, when the lights go off, it's not stabilized, especially when a patient is on CPAP, the vent. It consumes much oxygen. So until the light is done, then the oxygen plant restored, then the vent to be stable.
Because of the electricity consumption, I think director and management have been on the neck of BRA and NEDCO to get us a dedicated power line. We've still not been able to secure that, so that it will reduce the power fluctuations and all that. Currently, our CT scan machine is down. Efforts have been made to fix it, and it's because of these power fluctuations.
They climaxed the visit with a meeting with management and staff of the hospital. The members of the health committee poured laudations and encomiums on the management of the hospital for working to make the hospital not only clean, but ensures that equipment are maintained properly despite the challenges faced. Chairman of the health committee and deputy ranking member, Dr. Market Danwani and Dr. Bochi Yodon Patrick, respectively shared their thoughts on the visit.
And I believe that something positive will come out. Yes. We've seen the problems, the PCR machine is only one for a region that usually have an epidemic of meningitis. That is not enough. They need 1 or 2 of such machines to add so that they can manage their meningitis cases, from the standpoint of science. They are doing very well. And we want to report that they can look at the possibility of converting it into another teaching hospital in the northern part of the country.
I say we commend the staff and the management for the wonderful work they are doing here. They are not only taking good care of the patients, but they are also taking good care of the facility around. I think the hospital is doing something well here that other facilities must come and learn from.
Reporting for Dway News, Rafik Salam. Wow.
Born to a trader and a farmer in a small community in Budia in the eastern region, 31-year-old Dr. Alice Amega has emerged a global skills development specialist and advocate with a strong determination to give back to her community, country, and the world. And it is for that reason that she has decided to open an NGO to give back to society. Well, Dr. Alice Amega's NGO, Education and Aspiration Hub, recently returned to her hometown, Budia, in the eastern region, to introduce students from different schools in the regions to robotics and digital skills training. There's more in the following report.
There are numbered teams.
It's a Saturday morning, and students drawn from various schools in the eastern region have gathered in the classroom in Budia for the robotics and digital skills training organized by Alice Amega's NGO, Education and Aspirations Hub. They are being taken through the basics of robotics.
I felt a bit emotional when you want
In another classroom, Alice is inspiring the young ones, telling them they can achieve anything, no matter where they come from. At just 9 years old, Alice was told that her learning prospects wouldn't extend far beyond primary school, yet her academic journey took her from Ghana to Cambridge, and now she's back to give hope to others.
Don't see me too far away. Just a few years, a few decades ago, I'll say I lived in Buedia. I was just like you. My mother lived in Buedia, my father lived. I was born in St. Dominic's, and I grew up in Buedia. I went to school in Kebe. But I think I stepped foot in Presby, Buedia Presby, a few days before going to Kebe. And looking back, what the essence of education is so important. I can say that I have my PhD because I sat in a classroom to learn. I can say this project is possible because I learned. I had teachers who followed me and inspired me. But that wasn't enough if our future leaders and our young people of today can't benefit from all the knowledge that I have. And so this is why I decided to set up Education and Aspirations Hub.
Some of the beneficiaries are excited about what they've learned and have been sharing their experiences.
So I've learned the part of a robot and the sensors in the robot, and some of these sensors are ultrasonic, ultrasound, and many others. And we're also learning how to program an instruction into a robot for it to perform the tasks we humans want it to perform.
I have learned what the use of a sensor and how robots moves. A use of a sensor. So the sensor captures information from the environment and also measures distance.
I've learned that human beings make robots, and some robots use sensors, and there are types of sensors which are ultrasonic sensors, light sensors.
The story of Alice Amega is more than just a personal triumph. It is a story of hope for countless young minds in Buedia and beyond. Through her NGO, she is planting seeds of possibility, proving that with the right opportunities, even the smallest communities can produce world changes. In this interview, she shares the story of her journey from Buedia in the Eastern region to Oxford, Cambridge, and now to the world. She says her NGO is determined to change the lives of young people in Buedia using STEM and TVET.
You also have an NGO that you run.
Yes.
Education and what? Aspirations Hub.
So we started work in piloting the idea in 2021. Okay. So 2021 I was in Ghana and I was fortunate to get a grant for my field work, and I thought it wise, why not practice what I was researching and see what would be the outcome. And so I partnered with some organizations. Currently the transition from secondary school to tertiary in the district is less than 2%.
Did you say less than 2%?
Yes, it's less than 2%.
The rollover from secondary or senior high to the tertiary level, less than 2%?
Yes. So
well, that's how we wrap up the bulletin. For more news, please log on to myjoyonline.com. My name is Faustina Safo. Good afternoon.